You're watching 2 News at 7.
Because of vaccines, deaths are currently half of last summer's levels, despite a similar number of cases.
The push for vaccinations continues, plus how monoclonal therapy can help those who test positive. That's tonight's 2 News big story at 7 o'clock. Good evening, everyone. I'm Ryan Canada. Thanks for keeping it here. Ari will be back with us tonight at 11. Well, while COVID-19 is still widespread in most Nevada counties, there are signs case growth may be slowing down. We want to give you a closer look. Today, the 2-week average for new cases in Nevada, well, it fell to 932. That's down from more than 1,000 earlier this week. And Clark County's test positivity rate dropped to 16.8%. Good news on both fronts. However, Washoe County's rose to 17% for the first time since January. Well, the state says Nevada has had the second slowest COVID-19 growth in the past 2 weeks nationwide. And that masks seems to be working. But vaccines continue to be our way out of masks.
State officials say the vaccine is doing all the things it should, preventing people from going to the hospital and severe illness.
Because of vaccines, deaths are currently half of last summer's levels, despite a similar number of cases.
They say for 6,000 fully vaccinated Nevadans, only one had a severe breakthrough case of COVID-19. 97% of hospitalized cases are unvaccinated. Speaking of unvaccinated, many patients getting monoclonal therapy have not received the shot. Doctors say patients no longer need to be high risk to receive the treatment.
How the EUA is changed by the FDA, and the clinician can say and determine, you know what, I'm worried about this patient. Maybe they don't check one of those boxes, but they're moderately overweight.
We would just really promote, any of those patients who they've just received their positive result, to reach out to their medical provider.
To be eligible, you have to be sick with COVID-19 and in your first 10 days of symptoms. Patients have to be 12 or older and weigh more than 40 kilos.
We're at the point now where we are really wanting to inform our practitioners here in the States.
Covering the story, Valentina Bonaparte, 2 News.
And 40 kilos is 88 pounds. It's important to note that the therapy is not a replacement for the vaccine. Those who receive the treatment should still get the vaccine.